When you're preparing to have a baby, there's so much information out there to get your head around. It's hard to know what to follow and what to avoid.
So we've brought in a leading fertility expert, Dr Lynn Burmeister, again to talk us through the best ways to boost your chances of getting pregnant. Dr Lynn, thanks for coming back. Let's start with women and couples in their 20s. It's the most fertile decade. How do you best prepare your body for pregnancy if you're that young?
Well, when you're 24, your fertility peaks and then it starts going downhill after 24. But who's ready to have a baby at 24? So if you are ready to have a baby, though, it's important that you look after yourself. So healthy lifestyle, stop the smoking, stop the drinking, recreational drugs are out. All those things will damage your eggs. And it's important to start taking a prenatal vitamin, one with 400 micrograms of folic acid at least. And it's important to go to your GP to get your vaccinations up to date as well.
Today, Lynn, a lot of women look to start a family in their 30s, and 35 is kind of highlighted, isn't it, as being the point where fertility starts to decline? Well,
the average of having a baby now is 30, which I think that's the ideal age because you've got your career on track, you're emotionally ready to have a baby, but a lot of women are also leaving it to 35, and the problem at 35 is your chromosomes start to get sticky, and so they stick together, and unfortunately we don't have Botox for eggs, us fertility specialists, so we can't do much about the sticky chromosomes, and the sticky chromosomes lead to more problems with the babies, such as Down syndrome and miscarriages.
All right, well, look, some people leave it a little bit later for whatever reason, and they're getting into their 40s now. So what's your advice then? Well,
it's very hard to get pregnant in your 40s. So if we follow a woman in her 40s for a whole year, her chance of getting pregnant is only 36%. So that's 4% a month. So we do encourage women in their 40s to come and see a fertility specialist early, because often they will need help.
And help in what sense?
Well, firstly, we'll check and make sure the guy's got normal sperm, she's ovulating, her pelvis is normal, but often they will need to start fertility treatment fairly quickly.
And if you have been trying to conceive and you haven't had any luck, when is it time to go and see a doctor?
Well, usually we say a year, but it depends on your age as well. And it also depends on what you're experiencing. Say if your periods are irregular, if you come and see us earlier, we can give you tablets to make you ovulate regularly. So it sort of depends on the problem. If you're over 35, you should see us within 6 months of trying.
Right. What about guys out there? Because I think it's the sort of the unspoken thing that a lot of blokes out there would sort of go, it's not my fault, you know what I mean? They sort of do that sort of thing. I mean, they'd have to come and see you as well,
That's right. I like to see people as a couple, and a lot of guys don't do their semen analysis, so they sort of think it's a girl's problem. But in actual fact, 40% of the time, it's related to the guys.
Right, and should they do stuff as well to sort of taper their smoking?
That's
Don't know why people are still smoking, but if they are drinking,
so
all that sort of stuff.
Smoking, drinking, recreational drugs will affect their sperm.
Getting into shape for guys too?
Getting into shape, yes. So if you're overweight, your sperm production will be lower as well.
Dr Lynn, why is it that some women have so much trouble conceiving and others, they seem to blink and they're pregnant?
Yeah, it's probably got to do with lifestyle and genetics. So lifestyle are things like, you know, your diet, exercise, not smoking. Smoking will really damage your egg bank. So those sort of things are very, very important. So you've got to look after your ageing eggs. So if you're not ready to have a baby in your 20s, you have to look after your eggs for your 30s. And the other thing is genetics as well. So if your mother had problems, so if your mum had fibroids or endometriosis or she wasn't ovulating, chances are that you might inherit some of those things as well.
But it's not the end of the world, because
no,
we can find people like you, can't we?
That's right. People can come and see people like me and we'll help them out.
We love that. Thank you so much, Dr Lynn.
Thank you.